Dear friends, my name is Ramakrishnan Parameshwaran. I'm presenting my study on brain-computer interface informed empathic listening assessment in psychiatry. I believe this assessment method can be applied for diagnostic assessment in any other clinical discipline as well. The key word in this is empathic. This is another term for spirituality that is mentioned in the biopsychosocial-spiritual model of care in medicine. Though we have been talking about the biopsychosocial-spiritual model of care for quite some time, so far we don't have an evidence-based understanding of spirituality in medicine. To start my evidence-based study on spirituality, I am focusing on the empathic listening assessment approach as mentioned in the current psychiatric textbooks. I have to quickly add that there are no illustrations of empathic listening approach to psychiatric assessment in any psychiatric textbook so far, nor is there any training on empathic listening assessment in any psychiatric or medical residency programs. On the other hand, the entire curriculum and training in the clinical chaplaincy or spiritual care residency is focused on empathic listening assessment only. Once I hypothesized that the empathic listening process is a meditative process, I immediately knew I can use this portable EEG-based brain-computer interface devices to study empathic listening process in an evidence-based way. This particular device is currently available commercially for training in meditation. To verify whether the provider and the care recipient in an empathic listening process would indeed go into a deeply meditative state, I wore this brain-computer interface device, EEG device, to my clinical visits in the hospital. From this pilot research, I am presenting 5 case studies. The qualitative data obtained from the empathic listening interactions in each of the 5 dyads reveal that the empathic listening process progresses through the stages of focused attention, self and transpersonal mindfulness, and an intervening stage of transcendence. These stages are built in to develop a framework for the empathic listening process, which I call as MT framework or mindfulness to transcendence framework. The neurofeedback or the EEG frequency patterns obtained in each of these 5 dyads provided a contemplative neuroscientific base or substratum for the MT framework that I just described. Neurofeedback reveals how not only the care provider but also care recipient goes into a deeply meditative state in a very synchronized way. When I studied the EEG frequency patterns in the empathic listening process, it clearly showed 3 different phases. A phase of focused attention predominated by alpha frequencies, a phase of mindfulness predominated by theta, and the phase of transcendence predominated by the gamma frequencies. In both the recordings of the patient or care recipients and also the care provider. This corresponds to the MT framework that I had developed, that I described just earlier. The empathic listening assessment is said to have several advantages. Number 1, without deeply and empathetically understanding the patient's signs and symptoms, our diagnostic accuracy improves. We experientially feel the patient's pain and suffering. We do not identify with them. Therefore, we are protected from the caregiver burden and burnout. 3. The empathic listening process through which we understand our patient's intrapsychic processes is indeed a phenomenological approach to psychiatric assessment. The phenomenological approach in psychiatry has been criticized in the past to contain metaphysical components that is argued as not evidence-based. Metaphysical, they mean spiritual or transcendental aspects of the empathic listening process. And with this study, I have debunked that criticism that metaphysical components in phenomenological studies cannot be evidence-based. They can be. At this point, I want to highlight the 5th case study wherein the care provider was not trained in the chaplain's empathic listening process. In that What happened was he was not able to sustain the empathic listening presence, and thus he derailed the healing outcome that could have otherwise been. I emphasize that empathic listening training process is a specialized training process for which we already have an accredited clinical chaplaincy residency training programs. In this study, I am not only presenting the evidence-based understanding of the empathic listening process for psychiatric assessment or for medical care assessment, but also arguing that we have a future direction for integrating evidence-based clinical chaplaincy curriculum with medical residency programs. Thanks so much for listening to my presentation.